and equality are two concepts that pervade our everyday lives and conversations. They dominate political conversations in today's climate. They influence policy making and decisions in the fair, equitable, and optimal allocation of resources. They've even sparked an ongoing debate in today's response to the current global pandemic. So what is equality, you might ask? This is typically defined as treating everyone the same and giving everyone access to the same opportunities. Equity, on the other hand, refers to a proportional representation in those same opportunities. Now, this representation can be based on race, class, gender, geographical distribution, and a host of other factors. Equity and equality are necessary in the discussions on health. Health indices and health disparities are different in resource-limited settings and in high-income countries, or otherwise known as industrialized nations. The equity thus refers to the absence of avoidable or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically. So therefore, it involves more than inequality with respect to the social determinants of health. One characteristic that is common to the people who experience health inequalities are poverty, marginalized persons. It could be indigenous persons, it could be people that come from different caste systems. It could be ethnic minorities, and usually based on gender, it's women. And usually, when they experience these health inequalities, is usually because of a lack of political, economic, or social power. For health interventions to be effective, they have to redress inequities. Life expectancy is a key metric for assessing population health. Since the 1900s, the average global life expectancy has more than doubled and is now said to be above 70 years. There is inequality in the life expectancy, however, and it is pretty large across several countries. In 2019, the country with the lowest life expectancy was the Central African Republic with 53 years, and in Japan, the life expectancy is 30 years longer. What is the solution to health disparities and health inequities? There have been innovative approaches that have been proposed by the World Health Organization and other organizations to address health equities and inequalities. Identifying those health inequalities and their drivers are thus essential for achieving health equity, as defined by the World Health Organization's 13th Global Program of Work. Monitoring these health inequalities is crucial to identify the differences in health between different populations and subgroups. This provides evidence of who is left behind and also informs health policies, the distribution of resources, and policies that guide those distribution of resources. It also influences interventions such as programs that are addressed to limit or reduce those gaps, inequities. The World Health Organization then developed the Health Equity Monitor, which helps to provide an evidence on existing health inequities, and it makes available possible tools and resources to monitor this and to help influence data-driven decision-making in policies that help address those equities. These tools include an interactive data visualization that helps countries, regions, and global organizations understand health needs, not just at the population level, but at the local and community levels. The Health Assessment Toolkit was also developed to help measure and assess what those needs truly are. And then the World Health Organization has come up with a couple of interventions that address these specific groups. Why is all of this important? In the current global pandemic that we've experienced, a couple of countries have actually adopted an equity-based approach in pandemic preparedness and response. And the case study we'll be discussing today is Rwanda. Rwanda, also known as the Land of the Thousand Hills, is a country with an interesting past and an even more intriguing present and projected future. Rwanda has emerged as a society that works to ensure the equitable access to health, education, and other basic rights for all its citizens. In a recent statement by the Minister of Health, he indicated that any health system is only as strong as its weakest link, whether it's Ebola, COVID-19, measles, or another pathogen.
universal health coverage is our best defense. As COVID-19 was declared a global pandemic, the country shut its borders early and instituted lockdown and shelter-in-place measures. Leveraging on the work done over several years to prioritize the creation of adaptable social protection systems to protect its most vulnerable, the government of Rwanda mounted a swift and robust response to the pandemic. At a regional meeting, the president of Rwanda declared, "We are working to minimize the economic hardship on our citizens while protecting their health. So long as any member of our community is vulnerable, we are all at risk. Therefore, we must work very closely together in the months ahead to face this challenge as a community." The result of this, only 2,644 number of cases have been reported since the first case was reported on March 15th. 10 deaths have occurred so far, and there have been 1,698 recoveries.
Which is the first not just in the region, but across the globe. So thus, with this in mind, in conclusion, disparities in the quality of healthcare and health outcomes have to be mitigated through promoting health equity rather than equality, saying everyone has access to the same resources. The use of intersectional perspectives when attempting to make these different aspects of medical care more equitable reinforces the powerful role that social determinants of health play in influencing human conditions of disease and just life. Now, it is therefore important that we disseminate an appreciation for the distinction between equity and equality in addressing health needs, especially as it relates to medicine. And then ensuring that we continue to advocate for the use of these concepts in developing interventions is widespread. It is also critical to ensure that we are truly measuring unprejudiced health systems, and then we are providing solutions that ensure that those prejudices are adequately identified, are acknowledged, and interventions are put in place to address those prejudices. Understanding the relationship between equality and equity ensures that slight difference in two letters ensures we deliver the right healthcare to the thousands that deserve healthcare, because health, as they say, is a human right.